COVID never really left, but it's making a comeback, and more people are getting sick, and so are hospitalizations. They're going up locally, statewide, and nationally. And now there's a new booster on the way. Well, tonight, Queen City News anchor Derek Dellinger is taking a closer look at where things stand. And Derek, also, I guess the big question, people want to know why this vaccine won't be free anymore.
Well, the main reason for that is because the federal government is not buying the vaccine anymore. States and counties are. But if you have insurance, you will very likely be covered. And if you don't have insurance or don't have enough insurance, there are programs to help you get it. 2020 isn't back again, but there's a good chance you know someone now who may have recently come down with COVID. Cases are going up, and if wastewater monitoring statewide is any indication, which it usually is for future case counts, we may be seeing more soon. A few years ago, that would have been cause for alarm. Today, it is not, at least not as much as it was.
We're nowhere near, thankfully, where we were in 2020 or 2021. We have 97+% of the country has immunity, some immunity to COVID, either from vaccine or from infection, or for most of us, from both.
Dr. Zach Moore is North Carolina's state epidemiologist. He's among 3 medical professionals Queen City News wanted to hear from on what exactly is going on with COVID.
It is becoming more like influenza. So it's not to say that we never see severe disease from it.
Dr. Katie Passaretti with Atrium Health says the push for boosters will likely be a lot like what you see with the flu. Many medical providers have noted that getting a COVID shot with a flu shot is still not what people are used to, but it will likely become more normal. Those shots will also likely now be covered by insurance too. Among the public, though, there has been talk and there have been questions about lockdowns, mandates, or restrictions returning, like what many of us had to deal with throughout 2020. Everyone we spoke with said no. Mecklenburg County Health Director Radar Washington says simply this is not 2020 anymore.
Those measures are not critical for our response activities because we're at a place where we have treatment options, we have vaccines available, we understand the disease, how it's transmitted.
So no chance of those restrictions returning, but one thing doctors wanted to know was the safety of the COVID vaccine. No matter what you have heard, here are the facts. Cases of health and heart issues with the vaccine are very, very, very low. So low that they don't show up on any safety profile with medical professionals. Additionally, studies have shown that the chances of having heart problems from COVID are higher if you did not get the vaccine. Alicia?